Hey there, and welcome to the Knee Gurus, your guide to understanding knee injuries and recovery. I'm Bevan Collis, physiotherapist and founder of Asia Physio. With our clinics in Japan and Singapore, we help people get back to doing what they love. Each episode, we dive into real stories and expert conversations about life after a knee injury, from surgeons and physios to patients who've been through it all. So whether you're fresh off an injury or just curious about your options, you're in the right place. Let's get started. Hello everybody, and welcome back to another episode of the Knee Gurus. I'm your host, Bevan Collis, and we're back again to talk about all things knees. This week we are speaking with Stephanie Peterson, who is a fellow physiotherapist who lives on the northern beaches of Sydney. And Stephanie's got a really interesting story to tell, I think. She has done an ACL on each knee and decided on a surgical route for one and a non-surgical cross-bracing protocol route for the other. So it's going to be super interesting to find out about Stephanie's journey. And let's dive in and find out a little bit more. Stephanie, thanks very much for coming on the show.
Thank you for having me.
No worries. Tell us a little bit about your professional experience now. I understand you're a physiotherapist working in private practice. How long have you been out, and what's your professional journey been like up to now?
I'm 1 year out of university, so just coming to the end of my first year. And then I work in private practice at Modus Health and Performance in the Northern Beaches. And then I also work for Manly Seagulls in their Pathways division, looking after some of the rugby league teams, both with the girls and on the boys' side, to keep things interesting.
Okay, so you went straight from university into private practice?
Yes, yeah.
Yeah. Okay, and tell us about your first ACL injury. When was that, and how did that happen? And tell us a bit more about your experience from injury to recovery.
Yeah, so my first ACL was 5 years ago now, and that happened snowboarding, which is fairly uncommon, but I was in the park early in the morning, so there was a fresh run into the jump, and I went to do a backside 360 off the jump, which is a full rotation.
Awesome.
And instead of landing on the transition, as you typically would, I completely missed the landing and landed on the flat. Mm-hmm. And so the combination of the compressive force from the flat landing and the rotational force meant that my front knee, dropped in, and I tore the ACL.
Where was that, in Japan or in Australia? Or?
That was in Breckenridge in Colorado, actually.
Okay.
So I was on the other side of the world, which was not very helpful. But interestingly, I kept snowboarding. So I got to the bottom of the run, went all the way back up to the top, hit the jump again, because as you do when you hurt yourself, you just want to test it out.
Yeah, of course.
And it gave way again, no surprises there. And then I thought I'd call time on that and go get it checked out. And then, had to get myself...
we do say as you said, it is unusual for snowboarders to do their ACL, but there's one thing we've learned from 20 years in seeing snow sports injuries. The snowboarders can do their ACL, but it's usually a high force injury such as that, where skiers often do it with those low force, just catching an edge at low speed, and the ski doesn't release, and that torsion will just pop the ACL a little bit. But snowboarders on low speed falls will rarely do their ACL. It's normally, exactly as you described, overshooting a boot or landing from a big drop. Anyway, so it's not uncommon for people to not realize they've done their ACL, skiers and snowboarders. And we do have some people ski on and sort of only decide at the last minute to come in and see the physio a day or two later, and you find out that they've actually ruptured their ACL. Anyway, so what happened after your injury until when you got diagnosed?
They originally told me it was a sprained MCL when I went and got it checked out in America. which I now know clinically was probably some hamstring guarding, lots of swelling, probably a false positive on my Lockmans. But I had a scan in America, and then the doctor there confirmed that it was torn. And so then I had to get myself back to Australia and get that surgical process going. And then I had surgery 3 weeks post-injury and, started that post-op recovery experience.
Okay, so you were just on a holiday in the States? You weren't living there?
I was living there for that. I was there for 10 years in that block. I grew up competitively snowboarding, so I was in a training block, and then that got cut short once the ACL was gone.
Okay, and what was the sort of message you received from the doctors in Australia? Was there any sort of discussion about non-surgical, or it was? I mean, you're obviously a high-level snowboarder, so it was pretty much just assumed that the surgery was the right choice for you without much further discussion.
Yeah, there was no discussion about any other management pathways, and that probably was because of the demands of snowboarding and the forces that go through your knees when you're jumping off big kickers. But it was pretty well straight to the surgeon's office and under the knife as quickly as possible to get that process started. No real any prehab or anything like that, which I probably would do differently if that was me today.
And did you have a certain goal on the horizon, that the timing of the surgery, having it done sooner rather than later, made it more likely you're going to hit some event or goal in the future?
Yes, the timing was a bit funny for me with that first one because Junior World Championships was 4 weeks later. So I ruptured it in February, in the middle of February, and then Junior Worlds was at the end of March. And so I remember I said to the surgeon, I was like, can't I just have the reconstruction after the competition? And he was like, no. And then the Youth Olympics was that following January okay. of 2020. And so that was kind of the goal, but that was 10 months post injury. So it was a little bit ambitious, but I had a flight booked on the 1st of December, which was exactly 9 months post my injury, to head back over for another training block. And so my entire rehab process, I had that flight in mind, and I was like, I've got to get on that flight. I've got to be ready to go, which definitely helped with the motivation to get through that process.
Yeah. With all those factors, I mean, that's the thing with once you've done an ACL, there's so many different variables that go into that decision making on the right pathway. And with those variables you've described, I can certainly understand why the surgeon was recommending early surgery. You're young, high level sports, twisting sports, big event on in 10 months. So makes sense. And what was your rehab like, and how was your journey from the surgery? Did you have many complications, and what happened there? What graft did you choose, and run us through that?
Yeah, I had a hamstring graft, and again, that was just what I had. I don't remember really there ever being discussion with that. And then I was very lucky because of my position within the snowboarding world. I got to do my rehab at the Victorian Institute of Sport in Melbourne. So I had a very thorough and well-designed program. So it was very high quality, had a lot of testing throughout. And so that meant that, I didn't have any complications that I knew of at the time, interestingly, that I was aware of. However, recently I went back and read some of the notes that my EP at the time shared with me. And he'd noted at time points like 8, 10, 12 weeks that I was having ongoing swelling and lack of extension, which I don't actually remember having any complications. If you'd asked me 2 weeks ago, I would have told you it was the smoothest process ever. But reading those notes, I think, it was different from his end. But I perceived it to be quite smooth and quite progressive with no real roadblocks.
Yep. Okay. And so you passed all the return to sport testing. I imagine they did pretty comprehensive testing there.
Yeah.
And did you make that training block before the Junior Olympics?
I made that flight and I got back on snow exactly 9 months to the date of my surgery, but it was just too quick of a turnaround from that to the competition with selection and all of that jazz that goes into it. So I stayed in America while everybody else went across to the competition, but I actually came back stronger in that training block than I'd left. I definitely was better and had a deeper bag of tricks following my surgery than I did before. So I don't think it held me back once I was back on snow.
You did a lot of the hard plyometric work in the late stage, sort of 5 to 9 months post-op, a lot of bounding and cutting and all that sweaty type rehab, I call it.
Yeah, plenty of that.
No, yeah, and with all that testing, you probably could identify some weaknesses, and I can see we often speak with our ACL rehabbers to motivate them to come back better than they were before. So that's great. And then you continued in your sport, and I guess started studying physio soon after that. And what has happened over the last few years?
That experience definitely inspired me to become a physio, as is a lot of people's physio stories, and injury leads to the discovery of the profession. But then with COVID, it was a bit funny timing with them shutting the borders, and I kind of got to a crossroads where I had to choose, do I wait it out and pursue that direction down that sporting line, or do I go to university and go study physiotherapy? And that was ultimately what I chose, and I'm very happy with my decision. And I think I enjoy being on the back end of professional sport more than being in the moment, because it's quite stressful. And so I just went through and got my 4-year undergrad degree, and I'm on the backside of that now.
Yep. So you stopped snowboarding professionally and at a high level once you got into physio?
Yeah. Again, with COVID, it was a bit funny. They shut the resorts, and so it was all came to an end. But I still snowboard. When I've got intact ACLs, I still snowboard socially and for fun, and still chase winters. Went back and did another season, just a working season rather than a competitive season, and that was a lot of fun too. So still get around it.
And have you had any setbacks with your knee over the last 4 or 5 years? Does it be giving way or giving you any trouble or pain? Or
I've never had an issue with my knee, and I've definitely put it in some testing scenarios. But strength wise, I've never had a problem. I didn't have any lingering deficits from my rehab. My hamstring strength came back up to symmetrical to my other side. No ongoing pain, swelling. It's been pretty much a new knee since that 9-month point.
Terrific. And what sport, aside from snowboarding, have you done over the last few years to test your knee?
I played a season of netball, which I survived. And then I started playing AFL, but that came to a halt pretty quickly. I think I got about 5 games in, and that was my career before tearing my second ACL. Okay. And then just snowboarding and skiing during the winters.
You're picking all the good sports to test your ACL with
I know.
netball, skiing, and women's AFL. You're reaching the top of the charts for ACL ruptures there.
Well, look where it got me.
Yes, so let's dive into that. So you started playing women's AFL recently, by the sounds of it?
I did the back end of the season last year, and then the pre-season block November, January, and then started playing in March, and then only lasted that 5 games.
Okay. I can still see it's a bit of a painful memory for you, but so what happened? Was it a contact injury or a non-contact injury?
It felt like a contact injury. I actually said when I spoke to the physios directly afterwards, I'm not sure if it was contact or non-contact, just because of the pain response. But no, it was in the last 5 minutes of the game, and I was chasing down a girl who was about to kick for goal, and I came at her from side on, so perpendicular, and went to step off my left to match her direction. And then, yeah, that planted foot and that twisting, and I felt the tear in my knee, and I thought, oh, here we go again. And then hobbled off the field.
Gosh. And when was that? Was that this year, earlier this year?
That was in the middle of May.
Middle of May this year. Okay. And how did you get diagnosed, and what was your journey like from injury through to the decision-making process?
Yeah, I knew straight away in the back of my mind, as much as I didn't want to admit it, but I went and found the physios who were on another field to have a go at a Lockman's, and they were inconclusive. They're like, we can't quite tell. And I was actually hopping around. I was doing single leg hops. I was doing crossover hops because I was trying to convince myself that it wasn't torn. To no effect, really. Actually, I had no pain, no instability, and no issues with that testing. Could sit in a deep squat. I'm like, I'm fine. Wasn't fine.
Denial's not just a river of music, we say.
Yeah. But anyway, I had a scan first thing on the Monday. Saw my physio colleagues first thing on Monday. Said, "Don't tell me. I don't want to know." And then I was very lucky that I was then off to training that afternoon, and my physio I work with at Manly, he was the first one to look at it and say, "Yep, that's torn." I was also very lucky that he straight up said, "That's a great cross bracing ACL." And I was like, "Oh, no, like I'm going to have surgery." That was my immediate reaction.
Interesting. So sorry, just to back up there. When you said to look at it, were you referring to he looked at the knee, or he looked at the MRI slides?
The MRI slides. So I'd gone and had the MRI and gone straight to training, and he was the first one to open it, and he looked at the MRI slides. And
okay. Well, he must be a good physio if he's reading MRI slides with an understanding of the healability of an ACL. There's not many people out there that can actually do that.
Yeah, he's got a good eye for sure. And then
you're lucky to come across him.
Yeah.
And did you heard about the cross bracing protocol or ACL healing? Or?
Yeah, I'd heard about it. They'd spoken about it at uni, but it was not something that was spoken about massively. It was kind of in the back of my mind. But again, I was like, I'm young, I'm active, I've got high sporting demands, I'm going to have surgery. And then that night we do clinic on Mondays. And so I was able to jump on the clinic list, and our sports doctor also independently looked at it and said, "Yep, it's torn. Yep, that's a great cross bracing ACL." And so he was the second one. And then now I'm kind of thinking, oh, okay, maybe this could be an option. And so I then emailed Dr. Claire Walsh out of Stadium Sports, who was one of my professors.
Oh, yeah.
And I was like, "What do you think? I've just ruptured my ACL." And she gave me some great advice and sent me through all the information packets and was like, "Just have a consult, see what they think. You might not even be a candidate, but you're better to come in than not." And then, had the meeting on the Wednesday, and
this is the meeting being a consultation with Tom Cross?
Yeah, with Tom Cross. So it was a pretty quick turnaround for me, from rupture on Saturday to MRI on Monday and in the brace by Wednesday.
Great care you got there. And so Tom agreed with your sports doc and the Manly physio that yes, your tear type was highly conducive to healing?
Yeah, it on paper was pretty much exactly what you look for in an ACL tear. Like the femoral stump was intact. My distance between the ends was only 2 mil, which is on the lower side. It was a proximal 1/3 tear. They thought that the synovial envelope was intact because I had such little swelling post-injury. So it was kind of like tick, tick, tick. And then Cross looked at it, was like, "This is a really good candidate." And then they took it to a secondary radiologist who also looked at it and confirmed what everyone was seeing. And so at that point, I was very lucky. I had 4 people look at it and say that was a great cross-bracing candidate.
We're so lucky. We deal with people that have torn their ACL from all over the world, really. And one of the hard things is to get that, well, one, the quick access to MRI, and second, the access to people who can read the MRI and understand those terms you just talked about the tear type and gap distance and those things to decide. So you're in the right city, I guess, and the right circles to get that terrific care. Did you still have any reservations about doing the cross bracing protocol, considering your experience doing surgery was, by the sounds of it, pretty good and you had a successful outcome?
No, I think I'd actually gone to watch an ACL surgery earlier in the year as well. So I'd had that input. And I think subconsciously watching it
Those
from
big drills
the outside, yeah, watching them drill in the knee and take it all apart and put it back together was a bit of a turn off to surgery. And it made me understand why it's so painful post-op, and just the combination of, my prior experience and going and watching, and then my clinical experience with our patients that we see in clinic. I was keen to not have surgery. And I think also I had so many great clinicians telling me I was a good candidate. I was like, I'd be silly not to take this up and at least give it a go. And I was definitely of the mindset of, you can always have surgery later, but you can never undo surgery. So
100%.
it was, it was a little bit of a no-brainer for me once I'd gotten all those opinions.
Yep. And which protocol did they choose for, or did you settle on? Did you do 8-week, 12-week, or how long did you spend at what angles of knee flexion?
I did the 8-week protocol because I had a grade 2 MCL injury as well. So that prevented me from anything more than that, just because you get too stiff. So it was 3 weeks at 90 and then slowly out. Weight bearing is tolerated from week 5 and then completely out of the brace by week 9.
Yeah. And what day did you go into 90? I know you ruptured on the Saturday. You saw Tom Cross, I guess, on the Wednesday, which is what, day 5 post injury. Were you straight at 90 at day 5, or did they wait a little bit?
It actually a little bit more roundabout than that, but yes, I was straight, because in my head, obviously as a physio, I know what they look for going into surgery. So I was like, right, I'm going to get this swelling down. I'm going to get my knee straight. I'm going to get my quads activated so that I'm in the best position for surgery. And then on the Tuesday, the day before I saw Cross, my physios at work were like, look, if you're going to see Cross and it's something you're seriously considering, it's worth going in the brace now and starting that protocol now. And then if you're a candidate, then you've started and you're on that road. If you're not, then you can just come out of the brace and you'll get your extension back. But I'll clarify that as physios, obviously we know what to look for in terms of DVTs and those other risks of bracing early. So I braced, it was 72 hours post by the time from Saturday to Tuesday.
What angles did you set that brace at?
I went straight to 90.
Oh, you went straight to 90 a day?
Yeah,
on day 3. Okay.
Day 3, and then saw Cross on day 4.
Okay.
And
so you hopped into Tom Gross's room already at 90, did you?
Yes, I did.
Okay.
I did.
Wow, he probably doesn't see many of those.
No. But that was off the back of also, again, I'd had those 2 great inputs early from Harrison and Dr. David Jeffries. So I kind of knew that I was likely going to be a candidate.
Yeah, it's crazy that it's so, this principle of going into flexion to after an ACL tear, for it to, for bending the knee to being so conducive to the ACL healing is kind of against everything that probably 90% of health professionals have been told at the accident emergency department. They're putting people into splints to keep the knee straight, and as you know, as us physios, we hate to see joints be stiff and joint muscles get weak. So we think, we've got to get this knee straight. We've got to get the quads firing. The quads aren't going to fire if the knee's bent, and it's just super interesting that there's this dichotomy of care in that acute ACL phase. So we don't in our ski resorts, we basically almost never put anyone at 90 because they've got a long flight to navigate. So we, in our discussions with Tom Cross, we go 30 or 40 to 90, and most people aren't able to get an MRI as well. So we do that, and then we try to get them going to 90 at about day 5 to 7 in an ideal world. But not many are going to 90 at day 2 or 3. Did Tom have anything to say about that?
They say that that 72-hour point is probably the earliest you'd want to brace from 90, just because of your swelling response in that first period, that obviously it increases your risk of DVT and that sort of thing. And so I think the advice now is immediately post-injury, 30 to 90, as they do in the ski resorts, and then 90 once you have that confirmation, and from day 3 onwards.
But I guess if your knee wasn't that swollen by the sounds of it, your synovial envelope wasn't breached, there wasn't a lot of bleeding, so you're pretty comfortable at 90, whereas those more swollen knees, a lot of them can't even flex to 90 for the first 5 days. Yeah.
Well, I mean, that's why I thought I'd also be a good candidate, was because I had no episodes of instability in that initial period, and so I was pretty comfortable going into that brace. With minimal swelling and no instability.
Yep. And how was your experience keeping the knee bent at 90? Imagine our listeners, we have a lot of people listening who are going through that learning curve that most people embark on after they've ruptured their ACL, and they're tossing up, envisaging themselves, how could I live my life with my knee bent at 90? It seems quite daunting. How did you find that experience? Were you able to work, and how did you navigate your activities of daily life? I was extremely lucky that my work were very accommodating with the situation. The first 3 days are definitely a massive learning curve. I was hopping around on one leg a lot because I hadn't quite worked out how I was going to manage it all. And then my glutes got sore pretty quickly. So I was like, okay, I can't keep doing this. And then just coincidentally, I sat down on one of the physio rolling stools at work and worked out that it was a great solution for getting around, because you're sitting down, so your knee's already at 90, and my hands were free. So I was able to carry my laptop or carry equipment or whatnot, and I was rolling around in the clinic and out in the gym. So I continued working. I dropped to part-time and just saw my patient list that I was already familiar with, obviously with the consent of my patients and their understanding of the situation, and carried on working for that period, just rolling around on this chair. I got one for home as well, and would roll around the kitchen and the hallways on this wheelie chair, and that actually made the process pretty smooth once you figure out your routine and figure out how you're going to do all the things you need to do. It's just a big inconvenience, but it's not painful of any sorts. You just got to figure out what works. Yeah, terrific. That's good you were able to work through it. And so you did 3 weeks, and then you're weight bearing at 5 weeks, and you've obviously been out of the brace now. How was your muscle wasting and stiffness in the knee when you came out of the brace, out of the protocol? It was interesting. The stiffness perspective was interesting for me, because I had been told that if you're going to be stiff, you're going to be stiff from 90 to 60. And when that day came for me, my knee went straight from 90 to 60 after being locked for 3 weeks. So I thought, I'm on here. I'm not going to have any issues with stiffness or pain because my knee so freely moved into that range. However, then it came from 30 degrees down to neutral into extension, and that was very stiff, and it surprised me, and it was quite frustrating at the time because I was under the impression that it wasn't going to happen. Yep. But it was much harder to regain my extension than I thought it was going to be, and the stiffness hurt much more than I thought it was going to. That was really, for me, the only period of pain was that 2 weeks between 30 to neutral. So that was a bit of a mental battle. But once I got my extension back, and it did come back with
some physio and some targeted extension work,
Mm-hmm.
stiffness hasn't been an issue at all. And in terms of strength, I coincidentally measured my hamstring strength the day before the injury, just mucking around with one of the other physios, trying different positions. So I have really good baseline data. And my hamstring strength, we retested it at 5 weeks at 30 degrees, and it was better than my pre-injury strength on my cross bracing side. And that was purely just off isometrics every single day in the gym. So I haven't had any issues with my strength. And then same with the odds. So that was almost the best part about it, was I didn't lose any strength throughout this process, or if it came back pretty quickly.
Wow. Yeah, that's terrific. I think a lot of people, even physios, when you see these debates spark up online about the cross bracing protocol, a lot of people dismiss it so quickly, just assuming that doing the cross bracing protocol means you come out with totally wasted quads and hamstrings. And when you speak with people who've actually gone through it, if they've had an excellent physiotherapist lead them through the bracing protocol, and if they've worked really hard, the overwhelming message we're getting is that there's often not a lot of strength loss, which is pretty remarkable, really, and counterintuitive.
Yeah, but I think it helped that I was in a gym every single day. So that was off the back of like loaded isometrics on a leg press and prone hamstring curl isometrics. So I'm not sure if you get the same result if you're just doing like body weight based stuff.
Yep.
But I think it shows that you can, if you're committed to getting to the gym every day, you can absolutely maintain your strength, if not improve.
Yep. And what about DVT prevention? Did you have a Doppler ultrasound, or did you go on the Xarelto rivaroxaban blood thinning medication? And if so, how long were you on that for? Did you have any trouble with blood clotting or deep vein thrombosis?
Yeah, so I know that I have the factor V gene in my family, which is a blood clotting gene. So but it's in my grandma, so they don't typically think it comes down to children, but nonetheless, it meant that I was on the blood thinning medication for an extra 2 weeks, as opposed to, they said at the time that everyone goes on it for 6 weeks, but I just took it for 8 just to be extra careful. But no, I didn't have a Doppler at that point, and I didn't have any issues with, any blood clots.
And did you have any negative side effects of the medication? Because that's another one of the big critics, kind of weapons when they choose to talk down ACL healing is negative side effects of blood thinning medication, which can happen, but you sailed through it pretty incident free.
Yeah, I had a pretty smooth process through that bracing period. I didn't have any negative things happen, so I was very lucky in that regard. But yeah, no side effects from the medication. But they do advise that you take supplements to counteract some of those, potential negative side effects.
What type of supplements did they recommend?
They recommend vitamin C. They recommend zinc.
Fish oil?
Not fish oil. There's off the top of my head, it was a while ago now. But yeah, there's a list that they kind of send you. It's not mandatory, but yeah, they say that we think that this will help along the healing. And if you want to do everything you can take an extra set of supplements.
Yeah. And okay, and we fast forward through to, I'm assuming you had the 12-week MRI. That's kind of the classic red letter day and the ACL healing. Can you talk us through how you went with the MRI, what the results were, and how was that sort of mentally going through that check to see if the healing had been successful or not?
Yeah, it actually wasn't all sunshine and rainbows for me, which was a bit of a surprise. So I had a scan at 6 weeks
Okay.
because curiosity got the better of me, and I was treating myself like a bit of a case study. And at the 6 week scan, they the radiologist commented, mild elongation but healing. And I had thought maybe that it was mildly elongated because it was the first time that my knee had been to 10 degrees. And obviously, we know that that's a position where the ACL is most taut. So I was like, oh, maybe that it's just sitting funny in my knee. But, and I was like, oh, it'll continue to improve across the back end of the 6 weeks. And then at the 12-week scan, I had that the day before I saw Cross. And of course, I log on and look at the images, and I could see that it wasn't as thick as the 6 week, and it was a little bit more hazy. There was some hyper intense signal, and the reporting place wrote the report very quickly, and they commented on that as well and said that, it basically didn't look as good as the 6 week one. So it almost looked like it was bruised. I'd done something in that between 6 and 12 weeks to stir up the healing a little bit. And the only thing I can think of is I stepped in a pothole wearing my brace at one point in time, and my knee kind of got jammed into extension. So whether it was that or something else. But anyway, so I went into the appointment already with the mindset that I didn't think I was going to get the result that I'd been hoping for that 12-week period.
Yep.
Which I think it was good to have that time to process that before I went in and heard that news from obviously the expert himself. But yeah, they classed it as a grade 2 because it did show some mild elongation in the 12-week scan. It was thickened, but yeah, it just had that mild elongation. And that was a bit of a punch in the guts, if I'm being honest. I was pretty devastated by that. Mostly because on paper I was the perfect candidate. There was no reason for me I thought there was no reason for not to get a perfect heel. I followed everything to the T. I did everything they recommend outside of the bracing in terms of diet, nutrition, and so yeah, it was pretty devastating. And that appointment actually ended with, we went and scanned my reconstructed side, because even though it was classed as a grade 2, he's doing a Lockman's and he's like, it feels stiffer than your reconstructed side. And I could feel it too. You can feel the clunk.
When you say stiffer, do you mean a more solid end feel, or?
Yeah.
Yeah.
Or a more solid end feel, or a shorter end feel, if you will. So there was the confidence that, one, feeling that clunk, because when I had the ACL injury 12 weeks before, when they do a Lockman's, you can feel the give. So that was reassuring.
Yep.
But yeah, so we ended up going and scanning my reconstructed side. And it turns out, I think I've got a little bit of creep in my hamstring graft, which they're prone to.
Yep.
So there's slight elongation in my hamstring graft on my reconstructed side. And Cross said to me, he called me after the scans, and he said, look, you've lived with your reconstructed side for 5 years and thought that it was a great outcome. What makes you think that this is going to be any different? And he's right. But yeah, I was pretty devastated, I think mostly because I know the research that a lot of the grade 2s don't develop into grade 1s or grade 0s. And the numbers around the quality of life scores are lower for grade 2s. And just hearing all of that was pretty devastating. But I think once I shifted my mindset and looked at how well I was doing functionally and where I was at 3 months post ACL versus 3 months post reconstruction, definitely made me feel more positive about my outcome. And it will continue to develop across the 12 months. So we'll see how that scan goes. But yeah, it was not the best news in the world, but yeah, I'm still confident.
Yeah. And I understand that the healing can actually continue even beyond 12 months. The ACL can continue to improve. And you touched on your functional outcome. You're still only four or 5 months post injury now. How is your knee functionally? What sort of level of activity have you been up to since you came out of the bracing protocol and rehab?
It's been unreal, really. Like I almost feel like I haven't torn my ACL at this 5-month mark with where I'm at functionally. I've started running, started doing a little bit of change of direction work. We've done a lot of tests now on the force plates, which, and I have, again, pre-injury data, and I'm matching that pre-injury data on a lot of the jumping tests. My strength is back in that 10% range on my quads and my hamstrings and my calves. So I really don't feel like I've torn my ACL, and that's the struggle for me because I have to hold myself back because I'm thinking I'm only 5 months post. I know that ACL is not mature, but it feels really strong. I got a lot of confidence in my knee. I don't think about it in my day to day. I've got no pain, no swelling, no real ongoing effects from the cross brace. So it almost feels too easy in a way. But yeah, obviously there's a long way to go, but I'm at that point where I'm trying to pull myself back and not get too excited, and put myself in a vulnerable position.
Yep. Okay. And so I guess our listeners might want to know what would you, if you had your time again, would you have chosen to go back and have the surgery before the cross bracing protocol? And do you feel like you have got an opinion on which of your sort of pathways for each knee was better, or do you feel like you chose the right pathway for the circumstance for each time? Or do you have any regrets and thoughts on the comparison between the two?
I feel like I chose the right pathway for each timeline, as you say. I definitely think there's still a place for surgery in populations that need it, when there's those meniscal injuries or when your ACLs doesn't fit the criteria for cross bracing. But I think if you are a candidate or you're someone who's interested in it, then I definitely think it's worth giving it a go and taking that approach of, you can always cross over to surgery. And for me, I was at a time in my life where I didn't have that timing restriction, or if I have to be back for something, and had the time to give it a go. And I'm really glad that I did. And I'm very fortunate that Harrison Nicholson, who's that physio who initially pointed out the cross bracing to me, had that knowledge to say, you should do this, because I was beelining it for surgery, and I'm very happy with my outcome at the moment with where I'm at with the cross brace. So I think it's really patient dependent, and it comes down to lifestyle factors and what you want out of what the next year looks like.
Terrific. Yeah, I think you really, for me, I think the care that you've had for both sides seems to be where I would like to see ACL care go in the future. For the first knee, it seemed like it was, you had high sporting goals, you had a timeline. We don't know what the tear type was like, but it was maybe it wasn't a healable one, being such a high force injury, and the surgery went well. And the other side, you were a great candidate for the cross bracing protocol and went down that pathway. So, what a great story. And thank you so much for sharing it with us, Steph. It's been terrific.
Thank you for having me.
No worries. Well, we'll have to touch base with you and find out when you get back to returning to sport, hopefully in about another 4 to 6 months from now.
Yes, not too far off, counting down.
Okay, thanks very much, Steph. It's been terrific chatting with you, and thank you, listeners, for sitting through another episode of The Knee Gurus. I'm your host, Bevan Collis, and for this week, that's all for now. Thanks for tuning in to The Knee Gurus, brought to you by Asia Physio. To learn more or explore online consultations, visit telephysio.com or asiaphysio.com. If you found today's discussion helpful, share it with someone who's exploring their knee recovery injury options too. Thank you, and bye for now.